Hi, everyone. This is Jim Sporer with ISSIP, the International Society of Service Innovation Professionals, and in preparation for our Transforming Industry Sector series with Penn State University tomorrow on healthcare, I have Paul Griffin here with me. And Paul, the first question is if you could just introduce yourself so we know who we're talking to. Again, this is just a kind of informal discussion for the ISSIP community. Imagine you've got, other people interested in service systems, which I know you've got expertise in that, other people interested in healthcare, service innovation, eager to meet you and hear your perspective. So thanks for
Okay,
joining
well,
us.
well, thanks for having me. So I am a faculty member in the Department of Industrial Manufacturing Engineering at Penn State. I came here about 4 years ago. I also serve as director of the Consortium on Substance Use and Addiction, which is part of the Social Science Research Institute at Penn State. Prior to Penn State, I served on the faculty at Purdue and there was a center there called Reagan Street, which was a healthcare systems focused center. But most of my career, I was at Georgia Tech in the School of ISSIP there. So, and as you said, my main interest, both on the teaching and research side, are in health systems and health analytics.
Great. So you've got both deep expertise in industrial and systems engineering, Georgia Tech, Penn State University, but you've also been doing this work in healthcare with substance abuse. And if you could, the next question is, how do you see AI or technologies in general or other factors besides
Mhm.
technology transforming the healthcare industry, the business, and your occupational role?
Yeah, so I would say the potential is really amazing. We're already seeing good advances in things like risk models and prediction, being able to help in terms of radiology for image analysis or signal analysis for predicting tachycardia, those kinds of things. Um, but I think there's a real potential for it to be transformative. Clearly, to my mind, one of the major challenges in healthcare is simply how we have information about patients. The electronic health record it was designed for billing. It just does not work well. And so AI, and there are already products that have been developed that are out there. AI really, and that leads to such a burden to the clinicians that AI really has the opportunity to transform that whole process. Just make it easier for a clinician to provide data. It makes it easier for them to identify linkages. And so I think that's one area that AI will make a big difference. Clearly, an individual's health is primarily defined by things outside of the provider. And I
Mhm.
think that AI also has a real opportunity to improve engagement of an individual with their health and wellness. And I think there's a lot of opportunities for doing that. There are some challenges, and I think there are frankly some structural issues. We can talk more about that later that have to be overcome. You know, there's healthcare data is protected data. There are a lot of agency issues in terms of who pays for healthcare. And so there is a disconnection at times between the patient, the provider, the payer, the community. And so there are challenges there. And I think the other key challenge in healthcare, unlike most other industries where transformation tends to lead to like increased productivity, savings in cost, new products. That doesn't always happen in healthcare. Often transformation leads to increased costs.
Yeah.
And part of it is I think and due because of the structure of how healthcare is provided. And so that's clearly something we need to address. That's not just a health systems issue. It's a whole economic and financial issue, a
Right.
complicated thing. But I think that's a key challenge for really us to see the full benefit that could come from AI and supporting technologies.
Yeah, I think so often a local optimization is not a global optimization. And we see that in interconnected systems all the time, where just because you make one part a lot better doesn't mean everything gets better. In fact, sometimes it means it creates new bottlenecks elsewhere. And I think in some of these future questions, we're going to touch on some of those structural issues and some of the data privacy issues that you mentioned, Paul. But to help the ISSIP community get a kind of big picture view of maybe two types of ways of thinking about artificial intelligence is, there's the automation and the service robot trend, and then there's the augmentation and there's the digital twin trend. Do you have any particular views on these service robots that are starting to show up in healthcare, or also, some of these AI agents or digital twins of professionals? Do you think that's quite a ways off still, or do you see that already starting to affect the way you're, thinking about healthcare systems?
Yes, I'll say a little bit about each of those. So clearly there's a tremendous need for autonomous agents like robots in healthcare. If you look at certain sectors of healthcare, like long-term care in particular, there's tremendous shortages. And just look at our aging population. I'm one of those. That there's a concern about how do we properly address that. Robotics can certainly be a helpful way. I've also seen a lot of success in the use of robots purely to help engage individuals. Just
Yeah,
having somebody to communicate with,
right,
reminder about taking your drugs at a particular time, helping with regard to loneliness and depression.
right.
And so I think that's another really key area where these autonomous agents can play a role. Quickly, with regard to digital twins, to me, the real exciting part is um, if you look at the gold standard for healthcare, it's always around randomized controlled trials. They're
Mhm.
expensive, they take a long time, they compute differences on the average as opposed to how things impact different kinds of individuals sort of in different ways. And so obviously they're an important component for evidence, but
Mm.
we have so much other kinds of data.
Yeah,
We have really good information about where people live, the environment that they're all the social determinants, as well as
yeah.
their electronic history, genetic data. And so this idea of having a digital twin where, in some sense, again, there's a lot of work that still needs to be done in this area, but in some sense, to help generate evidence-based, but through the use of a digital twin, that's so important.
Mm.
And as both for the clinician and for the individual. If I'm a diabetic, for instance, and maybe I have to dose insulin, I get information. So maybe I'm lucky enough, my insurance covers that I can get real-time glucose readings, but I still have to make a decision. When am I going to take insulin? How much am I going to take? And I really get no guidance uh, except my own experience. And so if I'm able to pull in information, not just about me and my genetic makeup, but link that across with other individuals, that, you can really transform how people are able to take control of their own health. And so I'm optimistic about that approach. There's obviously a lot of work that needs to be done, but I think that really can be a transformative uh,
Yeah.
approach.
Great. The next question is in fact on data, and you've already touched on this, but where do you see data scarcity issues that will hinder AI adoption? And with more data and more compute, is it possible to, you know, see these improvement measures? As you have more data, maybe you can improve part of the system. So do you see any Moore's law type possibilities if we have data? So I guess two questions: data scarcity, where do you see that? And where are we getting enough data that maybe there's a continuous improvement curve possible?
Yeah, so I think it's not so much data scarcity. We're getting really good at having lots of data. Look at what Google did a few years ago. They were collecting 2 terabytes of data a day on every individual in their study.
Wow.
I
Yeah.
think the key is because it's protected information, it's really hard to link. And so there's patient privacy. And so if I have data from multiple sources, it's not easy for me to connect those in a way that can be useful. And I think that's, if we can, so you can have a data lake, but being able to effectively following HIPAA to connect it in a way that's meaningful, that's the challenge. And I still think that interoperability, we've been talking about this for decades, but we're still a long way from being interoperable. And so to me, it's really the supporting components of data to be able to put those things together for AI to be effective going forward, as opposed to a lack of data.
Got it. Got it. Yeah, and this next question, question 5, is right up your alley, I think. I'll just read it, but it's, reformulate it as you like. Does your organization use or would like to use more model-driven decision-making, mathematical models, simulation models? And so really just curious, Paul, what you're thinking in terms of mathematical models these days. Do you see that evolving in some interesting ways?
Yeah, so I would say a couple of things. First, I think it's been it's only recently that mathematical modeling has started to become accepted in healthcare. There have been people that have been doing a lot of work for many years, but to convince, and part of it is we've written a lot of bad models, but so we're in part to blame. But for healthcare to look at modeling as opposed to the traditional approach where, like randomized controlled trials, I'm going out and collecting data, I'm running comparisons but where modeling really helps is that you can sort of look at the counterfactual. What if we did this? What would we estimate the impact if we did this intervention at a provider or in a community? And so there's been a lot more acceptance of modeling, and most providers now have simulation groups that are looking at patient flow modeling, trying to understand the impact of pop health in terms of what kinds of services and bundles that they should provide. And so there's a lot more openness to modeling now. And I just look at organizations like whether it's providers or an organization like the Centers for Disease Control, they've just now stood up a new modeling group, and they're hiring lots and lots of some of our students as well. And so I believe, the acceptance of modeling is increasing, and that we'll see much more of it going forward in the
Great.
future.
Great. What are some of the stressful, labor-intensive operations that could be targets for automation or agents in the future? And what about, areas of heavy cognitive load that might be targets for amplification or augmentation? Any ideas there?
Yeah, I would, go to the classic problem of nurse burnout. There are shortages in many parts of the country in nursing. It's a really hard job. COVID has not helped
Mhm.
encourage people to get into this field. So a lot of, frankly, we're importing, from other countries, and so there's they're constantly facing burnout, and so anything that can be done to help reduce some of the mundane aspects, and a lot of that is just entering information. And so we can make that simpler. Uh, um, that's now not an easy process. People will, write on their hand and take notes for at a later
Yeah.
time, entering all the data. That's also not a safe thing to do. And so if we can certainly help in terms of the interaction between nursing and the patient and the data that they need to provide. That's one area, and certainly improving how we schedule resources as well. We don't do a particularly good job at that. And again, I mentioned long-term care. That's an area I'm really concerned about in the future. The other area where there's real need is rural health. Rural health is broken,
Mhm.
uh, and um, uh, and so anything that we can do to improve access to rural health, and unfortunately, telehealth, we keep saying, well, telehealth helps to solve that. But in some ways, telehealth has hurt rural health in that it's careful about the types of services that it provides, those that can generate revenue without providing, it's certainly not going to deliver babies. And
Yeah,
so the the actual brick and mortar providers in rural, they're many of them just aren't sustainable. And so that's another area
yeah.
where we need to do a lot of work. And
Okay.
AI, I think, can play an important role in that.
Great, great. Yeah, that nurse burnout and rural, those small communities all over the place are really suffering. So those are great perspectives. Now, the next question, and we probably should go into lightning round because we have 3 minutes left. So I'll look
Sorry.
for short. No, that's good. Short bullet points. Are you starting to see more multidisciplinary teams when your engineers are out there with social scientists and business people all working together? Is that something?
Absolutely. And I'm really optimistic about that. I see that at universities. I see that. And so there's been a lot of change in that. So yes, there's been big improvement there.
Good, good. Yeah, I know most universities, big universities, have a hospital associated with them or whatnot. So maybe this next question, but do you see university industry relations in the AI era unfolding in some new ways or different ways?
Yeah, so there are the traditional ways so at Penn State we have the College of Medicine, but I think there's also many universities are doing a good job at making it easier for innovation at the campus. So they're no longer trying to hold on to the intellectual property.
Hmm.
They're allowing it to be shared, and that's encouraging uh, faculty to work.
Great.
And so absolutely, that's improving.
Open innovation. Yep.
Yes.
We promoted at ISSIP, so I'm
Yes.
definitely with you. So industry mentoring of students and the notion of T-shaped skill development for students where they have breadth and depth. What's your thoughts on those, importance of those?
You're aware of what's going on at Penn State. So we do have industry mentor program for our students. That's extremely valuable, very popular, where we match students with an alumni. And we are very much thinking, working through our curriculum with regard to, again, having the breadth that you can work across a broad range of people across a broad range of disciplines, but a depth that you can really contribute. And so that whole notion of T-shape is something we're trying to incorporate into our curriculum.
Great. And could you just mention a few of the professional associations that you think are important? I know there's a couple in industrial engineering, but just maybe mention them.
Yeah, so there is our main professional organization is IISE.
Mhm.
IISE has a healthcare um, organization within it. There's also Informs, which is more on the operations research side of our
Mhm.
discipline. They also have the Health Applications
Yeah.
Society, and so many of our students are involved with both of those organizations.
Great. And the last question, if we have time to squeeze one last one in, is uh, are there questions you think that you might ask the other panelists or questions we should be asking that we're not asking? What about questions?
Yeah, so I'm really interested in um, so, for instance, Dr. Marsh is both an MD, but he also has a company. And I'm really
Mhm.
interested in understanding how that gets integrated. Because part of the challenge when you're trying to design something is you have to figure out how do people get paid. And
Mhm.
so I'm really interested in how he sees the financial is he optimistic about the future that we'll be able to work that out?
Yeah,
or is that going to continue to be an impediment to innovation in healthcare?
great, great. Sorry, my cat joined us, but
That's okay.
I guess he's
What's your
indicating that
cat's
it's
name?
time to leave. But thank you so much, Paul.
My
Looking forward
pleasure.
to it tomorrow. I think we're
All right.
prepared, so we'll be in email contact. But thank you so much for
All
sharing
right.
those insights with the ISSIP community. Appreciate it.
Great. Have a great day.
Thank you now. All right, I'll stop the recording.